be doing an IV piggyback video. So to start, we're going to perform, the first step would be WII. So I'm going to wash my hands, walk over, I'll wash my hands. Okay. And then I'm going to and that's a trash can. And then we're going to, I'm going to introduce myself and provide privacy. Hi, Mr. Sweetheart. I'll be your nurse for today. I'll be your student nurse for today. I just wanted to introduce myself. May I have your name and birthday? Bob, sweetheart. Okay, I will be back in a minute to explain the procedure we're going to be doing today, the medication I'll be giving you and everything, and and do you have any allergies? Okay, just sulfa and shellfish. And have you ever had antibiotics before? Yes. Okay. So I will be back to explain in more detail about the side effects and what we're going to be doing today, but I'll be back as soon as possible. I'm just going to set that up for you. Okay, so I've introduced myself to the patient. I've provided privacy. I washed my hands. And later on in the video, I will inform and educate the patient and check IV sites. I already determined if he has allergies, and I'll be going over 6 rates later in the video. So for now, I just want to verify and calculate the drip rate. So I'm just checking the order against the MAR. So we're going to be giving Mr. Sweetheart 75 milliliters an hour of normal saline maintenance fluid in a 500 milliliter bag. And then we're going to be running a piggyback IV, and the medication label is already on, which I will show later in the video. So it's going to be Zolsem, which is an antibiotic. I've already looked that up. It's 3.375 grams per 100 milliliters sodium chloride, and I'm checking that against the MAR. Everything looks good. Later on in the video, I'll check the rips, tears, and everything on the bag, check the expiration date. But for now, so the order says we're going to run the Zolsem over 4 hours, meaning we're going to be doing 25 milliliters an hour to make the 4 hours of the entire 3.37 grams. So that's how I got that calculation. And then we'll just be running what the order says for the normal saline, which is 75 milliliters per hour. So again, it's 25 milliliters per hour to make up the whole 100 milliliters for 4 hours. And then I'll explain in the video in more detail and determine his allergies and his IV site and check everything for redness. For privacy, I've already washed my hands and checked the order in the MAR as previously showed in the video. Hi, my name's Annie. I'll be your student nurse for today. May I have your name and birthday? Okay, Bob, sweetheart, birthday. Do you have any allergies that you know of? Okay, so you're allergic to sulfa and shellfish. Okay, and have you ever had an antibiotic before?
Yes.
Okay, perfect. Okay, so today I'm going to be giving you Zolsem, which is an antibiotic. And you may experience nausea, vomiting, diarrhea. And if you do have any of those symptoms, you need to let us know right away. So anyways, I'm going to go set up your IV and everything, but please let me know if you need anything. And I'm also going to check your IV site on your right arm. There's no redness or swelling. And are you in any pain today? Okay, perfect. All right, if you start experiencing any pain or noticing any itching or redness at any time during the IV, please let me know so we can discontinue that for you. Okay, I'll be right back. Thank you. Okay, so I'm going to go. I have everything set up. I have my primary, secondary chewing, and my primary and secondary medication bags. So I'm just checking the order against the MAR, that it's the right patient, the right dose, the right drug, the right route, and the right time, and the right documentation. So I have 0.9% sodium chloride maintenance fluid. It's going to be run at 75 milliliters per hour for this 500 milliliter bag. My medication is already added by the lab on, so the medication is in here, and it's 3.375 grams per 100 milliliter bag. It's the drug Zolsem, an antibiotic. I already went over the implications and side effects with the patient. And the expiration date is 09/2018, so it is good to use. And I've already dated the time and the patient in the room on the back, so everybody knows what it's for. I'm just checking for rips, tears, and clarity on both the bags. Expiration date looks good. Same here. There's no rips or tears. Clarity looks good. There's no particles in the bag, so everything looks good. Okay, I'm gonna wash my hands.
So he had a
On
little
my
bit of
gloves.
grace, and hopefully that will extend his life.
And I have my primary and my secondary tubing and bags. We've already went over all the implications, side effects, the routes, and everything. So I'm gonna take my gloves and maintaining sterility. I'm gonna make sure not to touch too closely and just take this off. Okay. And then with my primary tubing, I'm just gonna take this off and spike it.
Well, I didn't forget. Okay,
Twist
so
and
then these
spike.
guys.
While twisting and turning, I'm gonna not get too close to the tubing
But I don't know that much
so that I
about
don't rip the
half
bag.
yet on them.
So I'm just gonna
there's
twist until I'm all the way in there.
Simhead plus a leaf box.
Perfect. And it's already clamped. I clamped it pre-video so that no fluid could come out.
3,
Right, and that looks good. Gonna make sure nothing drags on the floor or anything.
and so those need an
So I'm gonna hang my bag
kind of a message from Laerdal about that. So
just right
question mark
here.
is updating what
Okay, I'm hanging the bag, and then it's already clamped. I'm gonna hang on to this. Okay, so it's pretty locked. So I'm just gonna squeeze the bag until the drip chamber is half.
Squeeze the drip chamber.
Squeeze the drip chamber until it's half. So I would just squeeze the drip chamber until it's about a third to a half full. That looks good. And then I'm just gonna already locked it, so it's half full. So I'm going to just make sure the lines are entangled and everything, so we don't cause any air bubbles. And then I squeeze the tube, so I'm gonna just prime it. So I'm gonna like slowly unclamp and hang above the bucket until water comes out. And I'm gonna be checking for air bubbles as I go. Alright, so water is dripping out. I'm going to clamp it back up. The water is dripping out, so it's clamped back up, so there are no air bubbles, so we're good. Everything looks good.